Right. Welcome, everyone. As everyone trickles in, go ahead and just drop in the chat where you are from. Helps us all get acquainted. And it's easier too because we can't see you. And we'll go ahead and get this kicked off in just a couple minutes. Let everybody trickle in. Okay. Well, in the interest of time, we've got a lot to cover today. So I'm excited to welcome you all to our first of this two-part series, The Why Good Clinicians Quit. So we're going to talk about workplace contingencies, RBT retention, and leadership behavior that you can change. Before we get started, just a little bit about who we are. So I'm joined with Brianna Holm, our Director of Operations here at Headstart Health. I'm Dr. Sara Feldman, Director of Provider Engagement. And over at Headstart Health, we support BCBAs to go independently, start their own ABA companies by removing barriers that keep BCBAs stuck. So if that's something you're interested in, definitely link up with us. But today is really all about learning. So whether or not you're starting your own ABA company or you are a leader, this should be really tactical and practical information. As always, we have a lot of information to cover, and so we will send out all the slide decks so you have the opportunity to look at it and use that piece of information just in case we have to move quickly for any of those slides. So I'll go ahead and kick it off with our learning objectives. And so really our goal here, we can read the really great BACB learning objectives, but our goal here is to be practical, tactical. It's best if you guys participate with us, drop things in the chat, and that really helps us make sure that we are gearing these conversations to you. Brianna and I are going to have just more of a live and friendly conversation back and forth, but really want you to leave with some really simple ways to look at retention and RBT turnover in behavior analytic terms, and really have those practical low lift interventions that you can use. So with that, really we're going to start with this idea that turnover is a ripple effect. It's something that affects RBT or client continuity. And so every time we have an RBT come in and we are changing up the plan, then we have to kind of go back and decide, okay, is this a fidelity issue? Is this a training issue? And so it can definitely impact progress. And then for other RBT turnover effects, we see BCA workload. And so if you have a BCBA who's constantly retraining and having to do that, then it can be really frustrating. So all of these things here are super common. I would love to hear kind of in your chat though, what are some things that you think that you see? And I'll let Brianna kind of curate this. So please participate, you guys, in that chat. What are some things you think of why good clinicians choose to leave their job? We know the impact, we know it's not great, but why are you seeing clinicians, BCBAs, and other service partners really decide to leave?
And I can jump in as people are typing because I know it takes a minute to get the whole thought out on the chat. But overall, we hear a lot of reasons from values. This is, how I align myself with the company. This is what I love to see happen in a company, to more like realistic things like I need to make sure that I can make living and I have this amount of money that I need every month and this is the bare minimum. And so you see it kind of oscillate between different environments. And I think in general, what people are looking for, or good clinicians are looking for, are typically value aligned companies. They're looking for opportunity to grow and what that looks like. And they're looking for some clear conversations. And we'll talk about this later on, but how do you have those clear conversations with them? How do you say things like, this is when you will be eligible for a pay increase, and this is how you can grow at this company? Because good clinicians want to have that clear expectation throughout their tenure at the company.
Yeah, and I'm seeing some things here in the chat on supervision volume. So that affects both, right? So you have your BCBA who's feeling overwhelmed and possibly ineffective. You have your RBTs that are the ones that end up being ignored or not supported as much. We see that idea of that lack of support in there, homework balance. And then I think there's this concept of of burnout. Burnout to me means something different than it means to you, Brianna. And so I think as we think about that concept of burnout, it's a bit like saying tantrum, and the idea of it's a very muddy word. And it's hard to know what can I do as an individual to support what that looks like. And so as you start to think of that concept of burnout, let's definitely dive into what are some of the observable and measurable behaviors that maybe are an antecedent to that or are kind of that combination of what that feels like. And so that's great. When we start to think about what's predicting the turnover, we see exactly what Brianna was saying, right? So it's that supervisor support, it's workload, the idea of my scheduling stability. We'll dive into that one more. Career growth and job satisfaction. These are things that research has pointed out. And so we see that and we know that we're able to start to say, okay, if some of these things are happening, we should have a systematic way to measure the likelihood of somebody choosing to leave their job. And so I would love to hear from you all in the chat. What are some of those observable RBT behaviors that you start to see? So we can definitely talk about BCBAs, but let's really focus on RBTs here, on some of those observable behaviors that you often see that you are like, something's decreasing, or maybe something is increasing right before you go, "Oh, they're going to resign."
People type, happy to share my experience of, you know, especially with RBTs, you have those all-star RBTs who are like reaching out, like stimuli running low, or like, hey, this trial, we've been running it, and like this is what's happening. So some of that behind the scenes information, if you haven't been out to the family's house that week. And then you start to see those messages decrease. You start to see that like that above and beyond communication go kind of less and less as the weeks go on. That's always a red flag to me that there's something else going on. So a change in the like helpfulness behavior, if we're going to classify it, but those observable behaviors are like, you know, looking at what the outreach looks like, what the conversation with that individual looks like, and what they're talking to you about. You know, how much information are they sharing versus you having to ask for it. But I see some other good ones in here, like call outs. Yep, increase of call outs is definitely one, or lack of engagement in a session. That's a really good one. So, like, what is the quality of that session looking like?
And you can measure some of those too, even remotely through, trial counts and just knowing that, and what was your expectation or what was the baseline before? What does it look like now? So awesome. Awesome, you guys. Okay, so when we start to think about turnover and tension, there's a lot that's linked to kind of some key factors. What's really nice is we can predict turnover really from when we take a look at what was onboarding and training. So the most pivotal and most important part of likelihood to stay is that onboarding process. So was the training there? Did I feel equipped? And then ongoing training, am I continuing to feel equipped with what I need? And training doesn't have to be the sit and get thing. It can actually be ongoing conversations, supervisions within the session. Pay, obviously, it's like Maslow's hierarchy of needs, making sure that you have enough money to pay your bills and to live the life that you have. And so whether it's that you're doing an interview at the very beginning and it's pay alignment, or maybe it's this idea of ongoing pay and pay growth, those are things that really indicate that. And then we have opportunities for advancement. So this idea of the existential crisis of, is this it? Am I always going to be in this job, in this place at this time? Or is there something more for me? When we talk about praise for doing good work, people want to know what good looks like. The assumption of, if I'm not talking to you or I'm not in your session, it's because things are okay, was definitely a rookie mistake that I used at the very beginning. In the absence of criticism, should be the actual, you can fill in the blanks with, you're doing something good. Well, at the end of the day, that's not really something that other people want. And so that was definitely something that I did, huge rookie mistake. And I had to learn how to give out praise better. And then the aspects of the job itself, right? So if something is really tough, or I have too many tough kids back to back, or maybe I'm traveling too far, there are a lot of cancellations. Those aspects of the job itself can definitely indicate this turnover and tension. So I promise this is the maximum of like the book smarts conversation that we'll have. We'll really move into something that's more tactical as we start to go into that. So we want to identify what are those high work demands that predict increased emotional exhaustion and disengagement. And then we also want to start to think through kind of how can we provide some multifaceted supports, because that's what the research says. It's not just one solution, it's not just pay more, it's not just give praise. It really has to be a multifaceted solution in order to make sure that your work is going to be supported. And so we'll kind of keep going there. And I know that Brianna is going in and out. I just looked over at my Slack and she said, there's an earthquake going on. She lives in California, which is normal. And she said, BRB, be right back. So when Brianna's back from an earthquake, she'll participate with us. But from there, we'll just keep going. We've got a few scenarios that we're going to go through. We're going to talk about that behavior. So what did the RBTs start or stop doing that starts to kind of give us our spidey sense of, okay, turnover might happen. What are some of the root causes that we could have kind of gone back and said, I think that behavior was probably linked to this. And then how can we put this scenario into a behavior interpretation, so in behavior analytic terms, because really at the end of the day, I can't control another person's behavior, but I can start to manipulate the antecedents, I can start to manipulate the environment, and I can look at this in a really scientific manner rather than just saying turnover is turnover. We're going to have high turnover with RBTs. It's just something, a badge of honor of the field. That's really not something that I'm willing to say, okay, I'm okay with that. I know that there is an opportunity for us to have very meaningful jobs and very meaningful jobs for RBTs. And so, how do we make sure that they come in contact with all of the great things that come from delivering high quality ABA services? So, with this first scenario, I'll read this one out, but I want you guys to start thinking in the chat, what are some of the early indicators that that leadership team missed? What is the root cause and why did Nicole quit? And then what happened in behavior analytic terms? So I'll read that one. And Brianna, you get to learn too now that you have survived an earthquake in California. And so I'm going to read this scenario. We're going to talk about early indicators that the leadership team missed, what the root cause could have been, why did Nicole quit, and then what are some of the behaviors in behavior analytic terms. So putting that into something that we can really go back and study. So this vignette's the reliable one. So Nicole was a technician that everybody wanted on their case. When a child had severe aggression, Nicole got assigned. When a family was frustrated and thinking about quitting services, Nicole got assigned. When another RBT couldn't handle a case, Nicole picked up the hours. She was working towards becoming a BCBA and used to ask for every opportunity she could to volunteer for projects, requesting extra supervision hours, and staying after meetings to learn. Over the past year, though, something has changed. She has stopped asking for additional supervision and opportunities. She's stopped volunteering for committees and special projects. When leadership encouraged newer staff to take on and when leadership encouraged newer staff to take on opportunities, Nicole smiled and then and she wanted to give and said she wanted to give somebody else a chance. So sorry, can't read that one. Everyone thought that she was being supportive, but what nobody realized was that she was quietly stopped picturing a future for herself in the organization. Her caseload had become a collection of everyone else's hardest cases, and every day required patience, emotional control, and crisis management. One afternoon, after being kicked repeatedly during a session and then blamed by an overwhelmed parent for slow progress, she sat in her car and wondered why being good at her job seemed to make her job harder. 3 months later, she resigned. So I'd love in the chat for you guys to start adding in what are some of those early indicators that that leadership team missed? And is this a relatable scenario? Have you seen this before? Yeah, so Erin says that there's less interest, less zest for the cases she originally showed interest in. Absolutely. This is definitely something that's out of the book of what I've seen before, even in my own ABA company where I have really, really great interns and they become a default and a bit of a crutch in the absence of having other team members with really, really great skills like this person. So, absolutely. So, what was the root cause and why did Nicole quit? Can we describe that in more behavior analytic terms? Drop that one in the chat for us. So the root cause really is what? And if you need to do some like reading between the lines, some guesses, that's totally fine too. So Erin says it's increased response effort. Sure, absolutely. Anything else that you guys are seeing? Yeah, more punishment, the parent's upset about the behavior. And then honestly, at the end of the day, she's coming into contact with less and less positive reinforcement. Her response effort is super high. Awesome. Thanks for participating, Erin. Awesome. Okay. So when we think about this scenario, we think about, okay, Nicole has been one of the most reliable individuals. She is an intern. She should want the harder cases. She needs to have that. So Rachel says excessive response effort. She's got that ratio strain of too many hard cases. Absolutely. We do this as a default, one, because us as owners or as leaders, we're avoiding making a parent upset, right? And so we're saying, oh, well, Nicole will solve that for us. But in that case, what we aren't realizing is that there's a human behind that, right? And so we've stacked all these hard cases for her. She is having less and less essential reinforcement or payment for the good things that are happening and the help. And so by being that constant person, Nicole doesn't have the opportunity to ask for a break. And so essentially by quitting and resigning, she's able to escape this really hard scenario here. And so this is one area that I think we could have definitely caught it if we were looking at schedules. And so one of the things I used to do a lot with our clinic managers and our clinical directors is looking and seeing, okay, this is a very intense case. This is a little bit easier of a case. Can we have those paired up in the same day? Or this is a very intense case and it requires a lot of collaboration on a team. And this is also a little bit less collaboration of a team, very easy, or maybe it's highly reciprocal. So this child has really great reciprocal conversation. We're working on higher level skills like social and communication, and that fills maybe Nicole's bucket a bit more. So just because we are an intern and we should be learning our supervision, getting our supervision hours, doesn't necessarily mean that we need to give her all the hardest cases. We need to be able to create a menu in which this is the realistic life. And so we'll talk more about ways to advocate and support someone like Nicole in this scenario as well. Awesome. Okay. So one of the other areas that this is simple, easy, and so get ready to respond as well. This will be our last scenario that we go through before we really talk through strategies, but we have Ashley loved her clients and rarely complained. She was dependable, positive, and always willing to adjust when schedules changed. But lately, every conversation seemed to come back to hours. She paid closer attention to when new clients were discussed. She started asking whether cases were likely to start on time. She wanted to know if authorizations had been approved and whether discharged clients would be replaced quickly. Leadership appreciated her engagement and assumed that she was invested in growing her caseload. What they didn't know is that Ashley had spent the last 6 months wondering if she was going to be able to make rent. Between cancellations, vacations, illnesses, and authorization delays, her paycheck changed every 2 weeks. She stopped contributing to savings and started checking her bank account before getting out of bed every morning. When a local medical office offered her a position with guaranteed hours and predictable pay, she accepted before she had time to second guess herself. on her last day, she cried, saying goodbye to her clients. So, what are some of those early indicators that leadership missed or they misunderstood? Yeah, absolutely, Erin. So, inquiries about hours, case sizing, concerns over lapses in treatment, absolutely. And so, Brianna, we're chatting about Ashley. She has a really inconsistent schedule. She starts to really participate in what scheduling looks like, asks a lot of maybe concerned questions. Then she finds a job at a medical office and she's able to uh, have guaranteed hours and predictable pay. So it's simple enough. The root cause here is instability. It's instability in her hours. But Brianna, in kind of more behavior analytic terms, how can we describe this scenario?
Yeah, I mean, I think the observable things are, what does her session look like on a week to week, and so what are her hours looking like versus what I always go back to, what were the expectations set from the beginning, right? And so when they first took the role, was it, oh, you'll have full time? Because I ran into a lot of instances with RBTs, especially where they were like, I needed 40 hours of work, but especially with the billable time versus non-billable time, as their schedule was formed, that wasn't coming to life in the same way. And so really making sure, like, from the behavior analytic, like, what was said in that first meeting, the expectations set, and then what are those observable behaviors looking like. So, like, for this example, it's cancellations. Like, what is the percentage of cancellations happening with clients? And then going to another job that maybe is more like less likelihood to cancel, giving her the outcome that she wants. So her behavior showing up to work is going to be reinforced because she's not going to show up for work for a canceled session. And so when thinking about, what is the desired outcome that Ashley's looking for, where's her behavior going to be observed? It's going to be going to be reinforced. It's going to be reinforced at that new job where she can show up and have hours to work versus show up and have cancellations between vacations, illness, and other delays.
Yeah. I also find that a lot of times these things can be corrected with just a bit of a conversation and understanding. So there's a large group of people typically at a clinic. Some people have to have these hours and you have those people on a list, and then other people are a little bit more okay with being called off. And so we used to really pay attention to, okay, what's the percentage of cancellations and are we averaging and on the way to making sure we have what that team member was promised. So 30 hours or 40 hours. And if we're not going to make that average over 2 weeks, which was our payroll period, then what did we need to do to supplement it? Did we need to call off somebody else and let that team member join another case? Did we need to provide administrative time and let that individual build materials? Because at the end of the day, quitting and losing a team member is going to cost us more than the admin cost it cost to make sure that that individual had some time on the calendar.
Yeah, and I think what you call out is an important piece. Not only is it proactive planning of knowing, okay, this is our short list of people who must work 30 something hours or more a week because they need it for benefits or they need it for XYZ, but you also have the system in place. And so having a system in place to ensure that when we fall below that, we have these strategies that we can implement to ensure that we are doing everything we can, so even if maybe 1 week you're not able to get Ashley to her desired hours, she sees all the efforts that are going in to get that there, or she sees the change that's going to happen. And sometimes just that alone will keep your really good team members because they recognize all the efforts that you're putting in. They understand there's a system. They don't feel like they're just going unnoticed or it's going unnoticed that they are getting a decrease in hours. And so those systems and those clear conversations really go a long way with keeping those good team members in times when the environment isn't naturally reinforcing their behavior.
Yeah. Yeah, absolutely. Systems really make everything so much more predictable. Okay, perfect. So I'm going to go ahead and we're going to keep going through because I really want to get to the strategies and some of the tools that Brianna and I have used over our careers to really make sure that we are supporting our RBTs. And so one thing really here to point out is, sometimes staying feels really hard, and then sometimes staying doesn't feel as hard. And really, we can look at, our motivating operations here. And so the different variables that are happening within our workplace can start to alter the value of things like escape or PTO, alter the value of having something be really predictable, or supervisor support, or how much I'm being paid. So all of these things, yes, are great, but depending on what's going on within the four walls of our clinic or in your in-home agency, it can alter those values. So really thinking about how, although we have all of those systems in place, how are they all interacting with one another to increase the likelihood that you see staying behavior at the end of the day? And so let's dive into that one a little bit more. I would love to hear, Brianna, from you, how it can feel a bit like retention is retention or turnover is turnover. The field is the field. And for BCBAs who are part of a larger system, it can feel a bit like, well, it's the system. There's nothing I can do about it. So what is the role of the leader here in all of this? Can they affect retention?
Yeah. And, I think that there's two parts here. So, one, you hear it all the time, to your point, like the self fulfilling prophecy of like, well, this is an entry level role. We know that there's going to be high turnover. So, like, treat the humans as such. Well, if you treat them as such, they're going to respond to the environment that you create. And so I think it's really important when we're thinking about RBTs, especially, we think about what is our desired outcome? Our desired outcome is that they do stay with us for a long tenure so that we can help get those maximum outcomes for clients, so that we can really train them and see them grow in their career. And so as a leader, you need to create that environment. And I think the most important thing, and the thing that I have really pushed BCBAs, is a leader isn't just at the top of every company. A leader is the leader of that case. So you as a BCBA are a leader in this individual's
Right.
life. And so that
Yes.
is a really clear discrimination of like, you play a very active role. I have seen in companies and talked to people and heard stories of the company itself may not be doing well, may not be performing well as far as tenure of RBTs or growth with RBTs, but you see one caseload of BCBA oversight, and those RBTs are staying, and those RBTs are really happy as far as job satisfaction. And that's because that leader has that direct correlation of, to your point, accessing support, giving that support proactively, having clear conversations, being aware of like, wow, this RBT is on 8 of our toughest cases. We need to make sure that they have a break in between these two hard cases, or these sessions are making this RBT drive from all over, the place. Let's make sure that we look at their schedule as we get a new team member, and how can we make this more manageable for them? And I think some of the best BCBA leaders I've seen are thinking about this proactively. They're thinking about things like drive time. They're thinking about, what is those like almost invisible workloads of the session outside of it just being on their calendar that might lead to the likelihood that this person can't do this long term. And I think
Mhm.
whenever you're thinking about like, what are those things, just think about yourself. Like, if I had to live this schedule, or if I had to be in all of these sessions on one day, how would I feel at the end of the day? And when you kind of put yourself in their shoes, it's very easy to see like, okay, what modifications do we need to make to this environment to increase the likelihood that they're going to stay long term?
Yeah. And I think so yes, we're looking at that retention. I love what you're pointing out though about, you can kind of see these pods of people who are staying because they love their BCBA,
Mm-hmm.
who is their leader. If you are an owner or you have a lot of decision making skills, I really urge you to make sure that your BCBAs are empowered with a pod. And so they are responsible for the thriving and the failure of the RBT team that is there. And so if you can schedule your RBTs to really interact with that BCBA most of the time on different cases rather than being spread apart on 5 different BCBA caseloads, I would highly suggest that. And so that's really one strategy that we've used before. in my previous ownership life. The other thing is as the owner of the company, I hold the BCBA pods and the BCBA leaders accountable for the retention of their BCBA team or their RBT team rather. And so instead of saying it needs to be perfect, I'm not asking for that, but I'm looking for, was there preventable turnover? So was this RBT leaving to go to another ABA clinic? Did they stay within the same kind of field? Or did they move completely out of the state? Did they have a child and they've decided they'd like to, do something different? Or are they going into school full time and they're not participating in work right now? And so I'm measuring the efficacy of leadership through retention in that BCBA by really seeing, was it preventable or was it not preventable? But then the job that I have from there is to make sure that I'm equipping the leaders with the tools that they need and the permission that they need in order to help prevent that turnover and that and keep RBT is happy. And so we'll continue to talk about some of those strategies that I've equipped leaders with before, but those are really all things that you have to advocate for yourself. So if you're within that system and you feel like, oh, I don't have that, then we have to advocate for those things. If you are building your own company, I definitely say these are things that you need to kind of equate to, it's the cost of doing business. And you really need to be able to say, okay, you have the time, space, permission in order to make sure that these best practices are followed in order to make sure that your RBTs feel supported. So we chatted about this and some of that supervision support that comes through, really idea of just being timely and having your in-session modeling. We'll go through all of this too, but this is actually directly from the research, making sure that there is follow through with what you say. I cannot tell you how many times, Brianna, I've heard RBTs say, I asked so and so or my leader for that, but they're so busy. I just don't want to bother them again. Or I asked them a couple times for it, but they have so and so. And so what it comes across as is my supervisor's needs are more important than my needs. And the amount of empathy that I run into with RBTs is really, really high. And so they're very willing to say, oh, it's okay. I'll get my needs met when, things calm down. Well, spoiler alert, they don't calm down. And so really making sure that as a supervisor, I am noticing the patterns. And so I have coached a lot of BCBAs who kind of fall into two different patterns. One would be, I promise the world and I tell you, yeah, you're doing really, really good. I'm going to bring you this and this and this. And then the amount of promises that they have given is a workload that is not possible for most people. Like there's no way you could have built all of that in the next week. And so they're chasing for those materials, but it sounds like you're flaky. The other one is the BCBA who is afraid to hurt a feeling or also is maybe a bit distracted. And so they say a lot of things like, no, you're doing really good. Just keep going. Like, I trust you. And with that, it feels like you're trying not to micromanage, but what you're really not doing is giving guidance, mentorship, support, saying, I'm here for you. And so those things will fold into those strategies here, but that supervisor support and what you do in your supervision really affects that overall image of you as a leader. So we're going to talk about 7 really low lift, easy retention tools that you guys can practically apply right now. So we'll do some RBT check-ins. We'll talk about support request follow through. We're going to talk about what happens if you reach a barrier and you need to advocate for an outcome. Simple things like an RBT motivation survey, connecting your RBT with the client's why, identifying growth lanes, and having really transparent pay conversations. And so all of these things are easy to do if you have a system. If you're trying to ad hoc and join them in, it makes it really tricky. So Brianna, when you see RBT check-ins, I've seen a lot. I've seen really lengthy ones that come across as almost counseling. I've seen really efficient ones that get a lot done. So I would love to know kind of what's that ideal 15-minute check-in? What should that look like?
Yeah, absolutely. I think first piece of advice I typically give is like, when are we doing this check-in? And so I think it's very natural for the BCBA's motivation is to like, okay, after a session, I'm just going to grab this person. We can talk, as we're walking to our cars and I can check in. But you need to think about everything that took place up until that moment for the RBT versus yourself. So maybe you're doing an overlap for the last hour of session, and then you're going to grab them at the last 15 minutes. But that 15 minutes for them is the end of their day. And they've been in sessions for, 8 hours or 6 hours of that day. They've drove to 3 different houses, or they've been in a clinic where, individuals have been engaging in problem behavior or whatever. And so where are you catching them? Where's their mindset? Do they know this check-in is coming? Do they know that, the point of this or the goal of the check-in is to highlight areas where we can support them more? Because
Hmm.
if you're not, setting the stage and thinking about when you're doing it, you're going to get the quick, dirty yeses, as I say. They're going to say, yes, everything's great. I don't need anything. I'm perfect. And you're going to walk away and you're going to think, wow, I'm a really good supervisor. That RBT is so
Yeah.
happy. When in reality, they're just trying to get this to end because they're starving, or they have to use the restroom, or they have something else going on after work. And so, you know, outside of these questions, which are great, very concrete, like questions to ask, I think you need to think about the environment of like when I'm having this. I love to tell people when I'm going to do a check in, I love to tell them the goal of the check in. Hey, I see that we're both free at this time tomorrow. I threw time on our calendars. I would love to check in on how things are going. My goal is to make sure that if you need extra support or if additional supports need to happen, that I am creating a plan for it. Again, to your point on
Hmm.
the previous slide, I say I'm creating a plan. I'm not promising I'm going to make anything happen. I'm not saying that I'm going to move the sun, moon, and stars
Hmm.
to be able to make it happen. I'm saying we will create a plan. And then to that point, I will be able to do that. But I think in general, we optimize on our schedule a lot where we need to pause and optimize on the RBT schedule and optimize on their mindset to really get the good data of how things are going in their schedule and their day to day.
Yeah. My rule of thumb was always you needed to have at least two 15-minute check-ins a month. It needed to be during paid time, and it could not be with a client present. And the check in could not also be punitive. And so, if you were having a punitive conversation about something that happened, you don't get to double dip. This is not like this is not your welfare check and you're also in trouble type thing. Because what I want to do is create this environment in which you are prioritized. And so this is about you. This is your time. This is your growth. This is not about me. And so if I'm giving you hard feedback or I'm writing you up or I'm doing something, then that is really more about me. And so it doesn't help or foster what we're looking to achieve here. Time is hard. Our schedules are hard. People quitting is harder. And so it's more important for us to put that 15 minutes on the schedule. What you can have is somebody swing in and be able to still see that client at the same time. Maybe you have a BCBA who's able to overlap. Maybe your clinic navigator or your front office operations person, maybe that person's an RBT and is a swing therapist for you. And so they could definitely check in too. So, like, what I typically do is I start with that concrete win. I ask them to come up with the win. What was good about this week? Tell me. What is a barrier that you are facing? This is not about me. I'm not talking. I'm not being the advice monster here. Um, to connect with a current client priority. What do you need during your day that you don't have? Maybe it's coaching, maybe it's a material, maybe it's something about the facility or the space. Giving one piece of behavior specific feedback. That's very, very important. Instead of saying, you're doing great, make sure that we are saying something that you can also continue to grow on. And that for some of our younger BCBAs can be a little bit tough because it's like, how dare I tell you how to do what you're doing? I'm just really grateful. But it's very important that we're linking it back. I used to have skills checklists that this would be the time that we'd say, hey, on your last skills checklist, you scored an 87. 87 is an exceptional score. We're doing really good. Here's one specific thing I want us to work on for next week. Here's what it would look like. Next time I'm in your session, I'll model that for you. We want to be able to clarify the support. Who's requesting it? Who's owning it? When is the due date? So again, if they said that there was a priority or a need and they want that support, when am I going to come into your session next and let you know? And if I don't know when I'm coming into your session, then I can say I don't know, but I'm going to tell you by this date of when that might be. And then we're going to confirm that next step. So we have included in here just a nice check-in script. And so you guys can definitely take a look at that one. But I want to talk about the things that we should definitely avoid, which is those weird, open, vague questions. Like, is there anything that you need? Well, most people are going to say, and so, or depending on the time of day, just like you had mentioned, Brianna, the idea is like, I don't need anything right now. What I need to do is to get away from work because I'm all done. Really vague praise. So you're doing just such a good job and you just make him so happy. That's not helpful. And what I notice is the higher the performer, the more vicious and specific and like nitty gritty type of feedback they want. And that only happens for a few months at the beginning of a job. And then if you don't give that really, really good praise or that very specific correction, then they stop asking that question. And that's really when one of those first antecedent things that I notice of people starting to slowly disengage. Um, don't explain why nothing can change. We're going to have some areas that we can have some barriers, but let's explain what we can do. So I might not be able to do this, but here's what I can do. And then we're not going to use this for just corrective feedback. So, on the same idea of we're not going to promise the sun, moon, and the stars and then not deliver it, I find that this is one of the basic things at the beginning is I'll have a BCBA, Brianna, they'll go into the session, they'll have these conversations, they realize, oh my gosh, there's so many materials I need to make and I need to do all of these different things. And so you come out with this laundry list that is not human. There's no way you could get that done in the next week before your next supervision. And so I really encourage to have a very clear way of like, what did you promise? And this is actually really good in parent training and in your supervision session, because there's a lot of times where we promise things to parents and then we hit that threshold or that door and we totally forget. So having it clearly organized. And of course, you can do this however you want, but what was the request? Why is it important? Who is owning it? When is it due? And what was the outcome? And this works really well too if you have an intern that's on your team that's supporting with some of these like diligence requests or these additional like tasks and things that you need to be able to do. And so maybe you yourself, you're not building all of the things, but you were the receiver of that request. Do you have a system to make sure that you've followed through on those requests? And if something is sat on here for a while and you haven't been able to get to it, you still need to close it out and go and talk to somebody and say, hey, we no longer need that icon or this thing because we've moved on. I'm going to go ahead and take that off of our list there. And so it's all how you say it. It's not that we're just going to kind of take it, add it to the list, but we really want people to know where we are on it. And so over communicating the status of different things is very, very important. And so here's when you're going to hear back from me. I don't have the answer for you right now, but here's when you're going to hear back from me with more information. Request telling them thank you for bringing it to your attention. So it's not that they've done something wrong by poking a hole in the program and realizing you didn't have the stimuli. It's thanks for flagging it. I really appreciate it. It's that one team mentality there. Okay, so Brianna, when you run into systems and problems that you can't necessarily solve on your own, how could a BCBA start to navigate that without coming across as like, I can't do that. The system is broken and there's nothing we can do. Because that starts to instill a sense of like hopelessness and why are we here if nothing can evolve?
Yeah, and I think it's all about how you have that conversation when you realize this is happening, right? And so we give you a nice little script here of, how you can assess the barrier, the risk, and like really figure out like what needs to change. But I think the most important thing here is you have to recognize that the RBT's role is to constantly give us feedback of what's happening in session with programming. Maybe they are even telling you, yeah, like I am implementing a behavior plan and I haven't had anyone model this for me. Their role is to always communicate that. As a BCBA, your role is to prioritize and assess each thing they're saying so that you can look at the magnitude of what they're saying. So I would say something like an RBT implementing a behavior plan without modeling, high on the list. Let's make sure that we are looking at what the risk is and what we need to do to fix it, and we're prioritizing that accordingly. And you're looking at your the whole sum of everything going on your caseload to be able to prioritize that appropriately. But also, like, you need to recognize when you need more help, when you, to your point earlier, when you need to delegate. What are those, maybe there will be times where the barrier is kind of a low magnitude problem and you can delegate that to someone else. Or you can even say, like, I'm going to work on that in a month. And even though that feels hard to say out loud because you never want to say that to someone, if it is like, oh, we need a stimuli of a different colored cheese to generalize this target, but you also have an RBT who's implementing a behavior plan without modeling, you got to look at the whole problem
Yes.
set and figure out where to put your attention.
Hmm.
And I think that is where this kind of framework of decision making is really big, because you want to look at that risk factor. You want to see, like, safety concerns in my mind go to the top of the list immediately. Whenever I got a phone call about a safety concern for a client or a team member, you drop everything. You reprioritize your day. Those are what I would classify as, like, let them hijack your schedule. Let them kind of dictate where you need to put your time. But if it is just like a generalization, or even like, oh, we need this target stimuli to maintain a target,
Hmm.
okay, we'll work on that. But that's not going to be the top of my priority. And so making sure that you're reinforcing them advocating, because we want them to advocate, but also having that clear feedback loop of where it falls in the priority list, because that's your role in this system.
Yeah, don't hide it, but also don't be a martyr in all of it too. Of like, I have
Exactly.
so many things to do. Yeah. Okay. One of the most simple and elegant things we can do is to identify what motivates our RVTs. And so I do this in a couple different ways. I do a regular interest inventory. I want to know quick, easy things that I can do that help support my RBT and show them that I appreciate them. That could be they don't like Starbucks, but they like tea. They don't like this soda, but they like this drink over here. What's their favorite candy? Little tiny trinkets, things that you can do that show that I know who you are and I care. The other thing is identifying how do they like to receive feedback. And so this again, very easy rookie mistake. I am an in vivo processor. You tell me, you coach me, you talk to me. I'm not going to shut down. I want you to tell me, and I will do it right then and there. Other people, that makes them cry. And that is really hard because it feels like you're attacking me and I'm just doing the best I can. Auditory processing might not be the best for some individuals, whereas written words are what I need to have. And so I need to have some programs that are super, super robust. That's your love language telling me that like I've gotten that done. And the absence of having excessive details in that program feels disrespectful, like I'm not equipped. Versus for me, if you do that and you tell me I need to go read all these programs, for me, that's a really big lift and that's hard for me to do. I rather have a 10-minute chat and you just tell me the most important things. Of course, there's practicality issues with that, and we all have to be flexible. But when we're talking about meeting our team members where they are, identifying how they like to have that feedback, how they like to be recognized? Do they want a shout out in front of the group? Do they prefer a private conversation when when you're telling them that they're doing a really great job? Are they a person who just wants more growth opportunities and is hungry and wants to be able to do that? Another thing that was really helpful for me, and I know this sounds a bit woo-woo, but was the idea of the Enneagram and understanding what different people are motivated by. And so the idea that I have some that are an Enneagram 1 and they are perfectionists and they need everything to be perfect or it feels like chaos. And so, really making sure that if I'm writing a BIP for a team that has two Enneagram 1s on it, it is detailed, it is specific. I have proofread it, I have looked at it multiple times, and I have thought about all the different ways that this might fail and how can I make sure that it's ready. Versus an Enneagram 2 individual is very much a team player and they're going to overgive until they say mercy. And so can you notice when they are over volunteering, and when you see that person start to withdraw, then you go, oh no, things are not good. Versus someone like me who's a 3, I want to know that we are growing, that we are achieving, that we are going. And so all of those things are very helpful of making sure that as a leader you're meeting your team member exactly where they are. So we did a whole CEU on this a couple of months ago, but just connecting an RBT to the why. What is the purpose of showing up every day? And it cannot be to run programs. So I used to run around my center and say, hey, what do we do? And it can't be I do programs, or they say I'm increasing communication, I'm decreasing problem behavior, I'm improving quality of life. And improving quality of life for Jane looks like this, because mom says that she really wants to be able to walk through the grocery store without having a meltdown. Or they are religious and they want to go to church and they don't want to have to leave their son with a babysitter. They want to be able to all sit together. So this was the priority for them. And so understanding that the times that I'm working on sitting or waiting, it's not just a program, it's linked to something that's much bigger. And so when we celebrate those wins and we bring in real stories from the families and we talk about what that looks like, it makes me feel like I have an impact, and it makes the redundant days and the maybe what feels like rote trials feel like it has weight and it has purpose. And so for me, connecting to the why is really important. It was really impactful. And then the last two we'll talk about, Brianna, I'll kind of throw this one to you, but just the idea that there are other ways for people to grow within your organization. And then we'll talk about pay and how that feels a bit crazy too to do as well.
Yeah, and going back to your slide on motivation, I think it's really easy to connect RBT to client to programs to client progress. But we need to take a step back and recognize they're humans, right? So from the beginning, we are pairing with them as humans. And that's like the best advice I can give anyone is don't look at them as an RBT implementing your programming to look at trial count. Look at them as a human. Talk to them like a human. Figure out their interests. Figure out what they like to drink, but like, what is their goal? That was my favorite thing to ask RBTs when I first met them is like, what's your goal? Like, what do you want to be doing in a year? Sometimes they don't know, and that's fine. I can help you kind of navigate that. Sometimes they have a very clear path. They're like, I am doing this while I go to undergrad for that. And even though I'm a BCBA and I'm maybe not, everyone's supervisor as far as like becoming a BCBA, I can support you. I've supported people through law school. I've supported people going through nursing school. And, obviously not technically, I have nothing to do with either of those fields,
Right.
but I can, make sure that like, oh, you have a test coming up. Are you studying for it? How are things going? I remember things that are going on in their life. And so that's the first one. And then these people, these high achieving individuals, typically like growth opportunities, even if it's not practicum hours or becoming a BCBA.
Mm-hmm.
So can you set them up with a new RBT that's coming through to give them the ropes? I always love like culture builders as something that I would assign to RBTs that were really strong and they could kind of implement that from day one. there's some like fancy names here that you can use, but really what you want to take is you want to take your all-star team members and you want them to be models and you want them to show that across so that they're bleeding into your caseload, into your organization, so that it's natural. It's not just like, wow, we have this one all-star and then we have all of these other people. This one all-star is influencing the greater whole, and you're giving them leadership opportunities, and you're giving them, now you have an opportunity to give them more behavior specific feedback, because it's outside of just the standard RBT role. It's a leadership role. So you can say like, hey, I was watching so and so overlap with you or shadow your session. This is actually a really good way to train someone, or this is a really specific way when you're, fading out of a session, on how to get engagement from another RBT. So it's a whole new set of skills that you get to mentor them. So you become a new value add to them, but while giving them growth. And I think the fun thing about this is, and we'll talk about the ladder on the next page of like pay, but some of these don't even have to include a pay bump. It's just new responsibility. It's new presence in the clinic or in a company that gives them a reinforcing factor of growth and gives them new responsibilities, which most high achievers are looking for and wanting for every day.
Yeah. Yeah. And so when we think about pay is one of those things that feels a little bit more taboo. Some are part of a system and maybe you have some rules from HR, but if you're inventing your own company and you're deciding what this should look like, pay transparency is really important. People need to know what winning looks like. They need to know what steps they need to be able to do in order to achieve more and to earn more. And so there's a lot of dissatisfaction that comes from pay and benefits as that reason for turnover. But there are ways that we can really navigate this to kind of make something that seems muddy and gray into something that seems very clear. So it's not always about giving the raise right then, it's knowing how can I get that. And so can we make a roadmap that shows a very clear and simple step? It needs to be based off of tenure and reliability, also your therapy quality, also professionalism. And so really having this like multiple pronged approach of making sure that you are reinforcing ideal team members, but then you're also showing incremental steps. And so at the beginning, it can feel a bit impulsive of like, oh, well, Brianna asked for a raise. Let me give her a raise because I can't afford to lose her. But what could be better is eventually showing that we have an RBT level one. They look like this. This is what the pay band looks like. When you've been with us for 6 months, then here's what this looks like. But we only get this pay band if we have attendance at this rate, and if we have professionalism or culture quality scores at this rate, and our therapy quality looks like this. So now what you have done is you've solved for three problems at once and shown that it is something that we're going to reinforce. It does not need to be something that you're overly compensating. So you're saying every 6 months you get a $2 raise, but it is showing that there is this opportunity to win and to win consistently on there. And this is a really great place for you to remove and to be a bit more humble in your approach. Just because you worked for years without a raise when you were interning, becoming a BCBA, does not mean that that's what this generation of team members needs in order to succeed. So you can either fight that or you can embrace it and help solve for it at the same time. So we have a good helpful how to talk about money in there. And so if that's something that kind of makes you feel a bit uncomfortable, definitely take a look at that one. But in the interest of time, really, we want to just kind of wrap up and make sure that you guys have those key takeaways. We will definitely dive into more behavior analytic strategies for retention and support in part two. But when you are working with your RBTs, we want to just make sure that we lower that response effort so that they're able to get help early. They can ask for help so that they feel like they understand their programs and they're feeling really competent. They're linked to that child's why. They have some sort of meaningful reinforcement, and a pizza party is not reinforcement for most. And then are they able to grow and see their impact and see it impact others? Because at the end of the day, we want to be heard, we want to be connected, we want to understand that we have some sort of imprint, impact or difference in the world that we are serving. And that's really simple for us to do if we are systematic and we go ahead and create those processes ahead of time. So for next month, you guys can catch us. We're going to talk about retention formula, applying behavior science to leadership and team culture. So we'll dive even more into that. You can scan that QR code to register now. We'll send that out in an email as well. And in the interest of time as well, since we've had some technical difficulties in there, as your exit question, I'd love for you guys to add in what's one thing that you are going to do in this upcoming week to really support your RBTs and reduce what turnover looks like. So something you're going to take away. So drop that in the link there. And then be sure to scan for your survey. We'll also email those out as well. Thank you guys so much for attending, hanging in there with some of our technical issues. Can't stop Mother Nature. But we hope to see you guys next time. If you've got any questions at all, feel free to reach out. This is how to connect with us, and we'll see you soon.